Hi, I am Dr. Jay Hitson with Blue Umbrella Medical Center, where we have innovative, integrated health solutions. Neuropathy is a really difficult condition. It's that intense burning, numbness, tingling in the hands, the feet. A lot of times it can cause problems with balance, really impede people's lives. A lot of times people have a really difficult time sleeping at night, restricts what they are not able to do with their lives. And if it continues to progress, which neuropathy is a progressive condition, it can lead to disability and even amputations. So it's absolutely a condition that we have to take very, very seriously. So many people who come to us have been told there's no treatment for neuropathy. There are no options for neuropathy aside from the gabapentins and the Humiras and some of the various painkillers. And while that particular statement used to be true, it isn't true anymore. Now, please understand, neuropathy is a difficult condition for healthcare because it involves the nervous system. And the nervous system is really what's in control of healing. So you're trying to heal when the healing system is the system dysfunctioning. It's kind of like if you saw a fire truck on fire. The equipment responsible for putting out the fire is on fire. That's kind of what's happening with neuropathy. It's hard for the nervous system to heal itself because it's in charge of the healing. So with neuropathy, one of the reasons why it's been so difficult for healthcare to address it is because it's multifactorial, and therefore we need different specialties to all come together to be able to address all the factors. And that's what we call an integrated approach. I would say the easier way to refer to it is as a team approach. And all of the various members of the team really have to be able to work in unison in order to be able to address all of these symptoms that come along with neuropathy. Let me give you an example. For instance, there are absolutely certain dietary things that exacerbate neuropathy. Now, if you go online, you look that up, and you just stop eating those certain foods, some people are like, but I still have neuropathy. Yes, of course all you've done is stopped creating new fires. You still haven't addressed the situation. You still haven't addressed the balance issues. There's a different therapy required to address whenever there's issues with not being able to know where your feet are. And that inability to walk on uneven ground, okay, that's a different therapy. And the foods you choose aren't going to do a great job of working with those particular symptoms. So we have to work with that. And then furthermore, okay, even working with the balance therapy and getting all of those different things to work right, well, that's not going to restore the myelin that's been lost. And that's a different treatment to restore that. So when you look at neuropathy like it's just this one problem, this one thing, that's where healthcare has been letting you down because it's multifactorial, and you have to circumvent the nervous system, which controls everything, in order to be able to get results. But the encouragement, let me just say, the encouraging thing is that there are centers out there like ours that are doing it all and addressing all of the different factors. In just for wherever you're at in the nation and wherever you are suffering with this particular problem, there absolutely is a dietary component that needs to be addressed. There absolutely is a neurological component that needs to be addressed. There is a rebuilding component. It's almost like the body has been traumatized and it has to have therapy. So physical therapy has been really huge in being able to bring back. And then, yes, there are certain technologies that are making it so much easier to bring that back. We're using electric cell stimulation. That's been fantastic. It's a medical treatment. And by the way, can I just be a real encouraging point to you right now that a lot of the treatments that I'm discussing and bringing up here, they're actually covered under insurance. So this isn't one of those things where tens of thousands of dollars later, we're finally getting to some results. insurance companies are covering almost everything that we are needing in order to be able to get people restored. The hard part is just the team approach and finding a team that can work together and coordinate all of their efforts in the right timing to get the kind of results that you're looking for. Because any one of these different things by itself is lackluster. For instance, we have this phenomenal technology that does a great job for rebuilding the myelin sheath, but that by itself, without some of the dietary components, it's just not as dynamic, and it's not the full vibrance that a lot of our patients are looking for. So we are really happy that we can get this fullness of results and get people back to their lives and doing the things that they want to do, and being able to walk and to experience and travel again and do all of those things. I know some of you are just, I just want to sleep through the night. Yes, getting all of those different factors is our heart and our passion, and that's what we really want for you. So if you've been told that there is no treatment, we just want to give you some encouragement. There's a lot that can be done, and just get the right team behind you, and you can see some great results. I'm Dr. Jay Hitson with Blue Umbrella Medical Center.